So this is not my work. I was asked to present this presentation by some friends from Hospital Clinic and Center Alomar in Barcelona, and particularly by Mattias Quarcia, who could not be here. So he asked me to present his results, their results in face joint treatment of focused ultrasound. They had, of course, the objective, the aim of evaluating the efficacy and the safety of this technique in the treatment of this kind of osteoarthritic pain, and of course to have a look also at the impact on quality of life and function. They enrolled between March and July to 2014, 7 patients with the chronic lumbar facet joint pain and with a specific diagnosis after block. The patients were, as I previously mentioned, recruited by the Hospital Clinic, and the treatment were performed at Alomar Center. The treatment was performed under 3 Tesla MR imaging and with Insightec equipment. As you can see, the treatment levels were from L3 to S1, so a wide range of double facet joints, and in mild sedation. Each facet joint was treated with sonication of 10 to 10 seconds on the capsular surface of the different joints, with up to 8 sonication per facet joint, so quite a lot of sonication there, and with a very low or correct, of course, for the aim of the treatment, joules delivered there in the joint. Of course, there was a temperature mapping, as you know, during the treatment, and after a planning, some images of the planning during the treatment in this kind of MRG FUS therapy, with a nice temperature mapping that allows you, of course, to see what happened in the nearby of the joint you are treating on. For results, they did not experience any kind of complication, or at least of minor complications, and they were successful with good results in terms of pain palliation and restoring of quality of life in the whole population, and particularly in terms of quality of life. They experienced a drop of 49% from the baseline and the follow-up, and in terms of disability and function, using the Oswestry disability questionnaire, they experienced a drop of 41%, or similar, and the same for the average NRS in terms of pain, approximately 50%. So they stated that in these very small but significant preliminary experience, MRG FUS has demonstrated to be a valid tool to face this kind of syndrome, osteoarthritis, pain at facet joints, and that this, of course, allows for several advantages that you well know. And stop. Thank you.
Any questions about that last paper? Could you go up to the microphone, please?
You can go in for a rhizotomy. Neurosurgeon can stick a bunch of needles in your back. You're out in 30 seconds, and you're back in the street, and you have no pain. Knowing this firsthand, this is not a big deal. I mean, this is probably several hours of your time versus 15 minutes winding up going into a cath lab, a little bit of fluoro, and they actually can go ahead and do the whole procedure. I don't know how this is going to be ultimately clinically relevant, because it just seems like an awful lot for essentially what can be done with RF.
Well, I think that in this for low back pain, the problem is not so easy. First, for the different origin of pain in osteoarthritis, of course, different from any other kinds of pain, and for the reasons for pain there. There are several reasons. It is not always so easy to understand the pain is just of the facet joint. The block, of course, is the gold standard, but sometimes it's not enough. And for the competing treatment opportunities, yes, there is a big fighting, a big. We have to say that there are several disadvantages now, starting from the time and the setting of focused ultrasound. But there are also, of course, several advantages, like the non-use of radiation, of ionizing radiation, and of course, the low invasivity. I think that in this setting for the spine, a potential level of fighting could be reached if this technique will become shorter in times. For the other points of view, I think that it could be a good alternative. And for other levels, like other non-approved sites or joints, I think that this could be also, like from the coaching experience in the knee or other that are coming, this could be also a good option for something that finds the solution just in arthroplasty.
Can I just say something about your comments? Whilst they're very valid, injections are usually very temporary solutions.
It lasts a year or more.
Well, you have been a fortunate person indeed, because in my experience, many injections are very temporary for many patients. And the intention here is not to replace injections, but to replace radiofrequency ablation of facet aspects, and to create a long-lasting solution to facet problems, so that you don't have to come back. Now, if yours have lasted a year, you are indeed a fortunate person, because many of the patients with facet joints who have back injections will be back there every 3 months. Yeah?
Indeed, I answered about the final radiottomy, not just injection.
Yeah.
Of course.
So it's not the injections you're trying to replace; it's the RF ablations that you're trying to.
Yeah.
Do exactly the same thing: raise the temperature up in that area and get rid of if this is due to focused ultrasound and you're raising the temperature, the RF is going to do the exact same thing. So
Absolutely.
And the time in a magnet and tying up a focused ultrasound machine while you walk into basically a digital fluoro system, the neurosurgeon turns it on for 15 seconds to stick your needles in and burn you for 30 seconds.
Yeah.
It's a little bit.
That's the point.
Yeah, it's a real hard to imagine how that's going to compete with this.
Yeah, very reasonable point. Any other questions for anyone who's had a facet joint injection? No? Okay, well, I think that concludes the session, and I think it's tea time.